Yeah, this is not exactly the update that I was expecting to give today, but yeah, so went to my neurosurgeon and found out the issues I'm having are not because of my brain tumor. So let's go back in time to Tuesday. So my husband and I went to DFW for my neurosurgery appointment. We left at like 6 a.m. and got there at like 11:30, and we went and ate lunch and saw my neurosurgeon at 1. And altogether, experience great. If I had to have brain surgery, I would pick him, right? But so, we do all like the paperwork and everything for him, and then we get into the room, and he comes in and talks to us, and he's asking me like all these questions about what's going on with me, and like detailing everything that's been happening to me over the last month. I'm like, okay, yeah. So my foot went numb, and then the whole left side of my body went numb, and I like was having all kinds of issues with balance, and I fell 3 times for no reason, and I was having issues with coordination and all that. And I went to the ER and they did a CT and they found a brain tumor, so now I'm here. And he was like, okay, asked me some more questions, and he was like, do you have a family history of any autoimmune diseases? And I was like, I knew where it was going at that moment. And I was like, no, not that I know of. And he was like, okay. And then he kind of paused and he was like, which there was so much more going into this. This was a long conversation. He kind of paused and he was like, I don't think what you're having is related to your cyst. And I was like, excuse me? He was like, yeah. He was like, what you're describing, if it was related to the cyst, he was like, it wouldn't have gotten better. You would still be the same amount of numb that you were when you were in the ER. So I'm like, okay, so what's that mean? And he was like, you wouldn't have seen any improvement. It would, if anything, it would have gotten worse. And he's like, we need to look elsewhere. He was like, but the cyst at the size that it is, and because he doesn't think it's causing my issues, no reason for it to come out now. We will worry about that in a couple decades. If we need to. There's a chance it just exists there and never causes issues. That's what I'm hopeful for. But if it ever needs to come out, it won't be for a long time. Okay? Upshot, I'm gonna have to have brain surgery. The bad news is, so what's going on? And he was like, I'm going to order an MRI on your brain, your neck, and your spine, and we're going to look for multiple sclerosis. Because that's what he thinks is going on. He thinks that I have MS. But he was like, I'm not sure. Let me see some stuff real quick. So I sat up on the bed, and he did a bunch of reflex tests with me, and like where he would press on my hand, and I'd have to like try to move it or whatever. And he looked at a whole bunch of different stuff. And one of the ones was he held my finger like this. Why is my hand shaking? He held my finger like this, and he kind of like flicked my middle finger like back and forth. And what was happening is I was having a reflex in these two fingers where they were like, it was so much more subtle than that, but they were kind of like going like that. And he said that's what's called Hoffman's sign. And that indicates damage to nerves somewhere in the central nervous system. And if you look it up, what can Hoffman's sign indicate? Okay, it can indicate spinal cord injury, it can indicate brain tumor, or it can indicate multiple sclerosis, among other things, but those are the top 3. So, one of those I do have, one of those is being considered, and I don't have a spinal cord injury that I know of. I feel like I would know if I had a spinal cord injury. So, we did that, and he was like, okay, so you have Hoffman's sign. That doesn't confirm anything, but it tells me we're going in the right direction, basically. And we talked about that, and I was, in the moment, like, I don't want to say disappointed because that's not it. I was just confused because for me, when this started happening initially, what came to my head was MS2 because I have intermittently had issues with like my muscles and like nerves and stuff, and I've had nerve pain in my foot for like years now. And truthfully, I just wasn't ready to approach it, and I wasn't having issues that were so significant that I needed anything for it. And when I began opening this, box of horrible things, when I started seeing my doctor for my insomnia, and I kind of knew it was going this direction, I was prepared for that. I was like, there's something going on. I just want to find out what it is. Well, things progressed a little bit too quickly, and I ended up in the ER. And then after, they found my brain tumor, I was like, okay, that explains it. Then I probably don't have an autoimmune disorder. I probably just have a brain tumor, And I was content with that. Like, I felt like that answered my questions. And now things are kind of up in the air again, and we're back to MS. I understand where, like, how he kind of described it, because I was like, why didn't we? I was really mad. I was like, why were we doing this a month ago? Because we've been farting around for a month, and I really haven't improved. And he was like, it sounds like your brain tumor is an incidental finding, and they kind of got a little bit focused on it, a little bit hyper fixated and excited about it, which I guess I can understand, especially because in theory, he said, like, primary care physicians and ER doctors, they don't have the scope of knowledge essentially to be able to narrow those things down. They just, like, ER doctors specifically, they just want to make sure you're not dying, and then they'll send you to a specialist. And they did. They made sure I wasn't having a stroke. And my PCP, she just wanted me to get into a specialist, okay? She's not an expert in everything. Fair enough. And he kind of explained it as, they did what they were supposed to do, but, they can't do everything. So we just have a new direction to go. And that kind of helped. That framing helped in the moment I was annoyed. So he ordered 3 MRIs for me to get done, he said, as soon as possible. So I'm getting them done on Monday, which is 2 days from when I'm recording this, to look for basically what's going on in my nervous system, particularly in my brain and spine. I'm just ready to figure it out. And then once he figures out what's going on, it really sounded like he thought it was MS. But let's say whatever's going on, he will refer me to whoever is appropriate, probably a neurologist, which I'm kind of about that because that was my first referral when I got out of the ER. And they didn't want to see me and sent me to a neurosurgeon. But, my neurosurgeon said he's going to advocate for me and make sure that I get what I'm needing, essentially. So I felt a little bit better about that. And it just raises a lot of questions that I've really been trying to not get ahead of myself because I still technically don't know what's going on, but we have a little bit of a different direction now. So the takeaway from this video is I still have a brain tumor. It's just not the issue. We don't know what the issue is yet. We have a suspicion. We'll probably find out with the MRI. So expect an update on that. I have to get the MRI done and then mail the CD to him because he's too far away to access it remotely. And then he said he will call me and let me know. And then we'll work on probably a referral. But that's kind of where I'm at now. It was a weird week. So, thank you for watching.